on where you happen to be in the world today. We're happy to have you joining us for this ABMS Portfolio Program webinar, and I thank you for just taking time to be with us today. My name is Tina Nelson. I'm the manager here of the Portfolio Program at ABMS, and with me are several of my colleagues, one of whom is Spencer Walter, who will be manning the slides for us as we go today. And I will ask that if you are not on mute, if you please go ahead and put yourself on mute at this time. Sorry, I'm just letting people in as they kind of come into the session. I apologize for being distracted. Today, we're going to talk about engaging physicians in improvement priorities through the ABMS Portfolio Program. And Spencer, if you could go to the next slide, please. Kind of what we'll do for the next hour is we'll just hear a little bit about what the portfolio program is, and then we'll hear from two portfolio program sponsors about their fantastic organizations, and then we'll take some time at the end for questions. We do have the chat available throughout the session, however, so if you have any comments or questions you would like to add while we're talking, please feel free to do so. Next slide, please, Spencer. All right, so we're going to start with just a little bit, kind of lay the foundation here about the ABMS and really what the ABMS is at the highest level. And the ABMS's mission is really to serve the public by improving the quality of healthcare. And we do that in partnership with 24 certifying member boards, which have almost 90 subspecialties covering 40 areas and almost 1 million certified physicians. Next slide, please, Spencer. And then kind of within that space of the ABMS, the portfolio program specifically really sort of aligns with some of the priorities that many organizations in the healthcare space are embracing and working on. For example, at the top tier on this slide, you can see education, quality, professional identity, clearly priorities of healthcare organizations across the country. And then specifically for the ABMS, we align those with those priorities through our standards and certification, and especially for the portfolio program, the improving health and healthcare portion of those standards and certification. And then at the bottom of this slide, we're kind of looking at an unofficial mission statement of the portfolio program, if you will. And you can see here that our purpose is really to provide excellence, foster a learning community among healthcare organizations, and really focus on improving health and healthcare. Next slide, please, Spencer. All right, so just a little bit of background, how did this program even come to be? So over a decade ago now, which is amazing to say that it was that long ago, but over a decade ago, there was this movement when continuing certification kind of came about within the CME community of people really wanting to be able to provide MOC, what used to be called MOC credit, for the providers within their organizations. And so at that time, the process was kind of, okay, we have this great activity. It's focused on performance improvement or quality improvement or patient safety. And we would like to be able to offer certification credit for our providers that are participating. And so we would then have to reach out to each of the individual member boards that we were interested in and complete an application, pay their fee, and hopefully everything aligned. And it often did not. So they kind of thought there's got to be a better way, right? And at that point in time, it was roughly 2009, Mayo Clinic, along with the American Boards of Pediatrics, Internal Medicine, and Family Medicine, decided that there had to be a better way. And they decided, let's try to implement this process and see if this works. Can we approve an organization and their processes for implementing, monitoring, tracking, physician participation in improvement activities? And what does that look like? Can we approve that process rather than the individual activity level? And the portfolio program was kind of born out of that idea. And at the time, and still today, it really became this useful resource and kind of a value add. For me personally, it was for my CME program at the University of Wisconsin. And all of a sudden, we were able to then say, not only can I offer you CME for this work, or CME credit for this work that you're doing, but I can also add value by offering continuing certification credit for that work. And it was really relevant to the physicians because it was for the work that they were already doing in practice. They didn't need to go to their board's website and find a module. We could really talk about what are you doing on the ground in your practice, and let me help you frame that so that it can be eligible for continuing certification credit. So that's kind of where this portfolio program came from. And that again started in 2009 and it has blossomed since then. Next slide, please, Spencer. So who do we work with? Like I said, we work with 17 of the ABMS member boards. You can see them here, along with the NCCPA, which is the certifying body for physician's assistants, who are also eligible for credit through the portfolio program. Next slide, please. So right now we have over 100 organizations that we work with, and this slide really shows you kind of where they come from. As I mentioned, I was a portfolio program sponsor myself at the University of Wisconsin, and this kind of started in the academic medical center space, right, with Mayo Clinic and several other organizations that were kind of invited in as time was passing, including the University of Michigan, who you'll hear from shortly. And so it sort of made sense. It makes sense if you look at this pie chart that the biggest portion of sponsors within the portfolio program are from academic medical centers. However, many years ago, we started to kind of broaden the scope of the program and who would be eligible to be a portfolio program sponsor. And now there are multiple different types of organizations, including, as you can see here, integrated delivery systems, societies and associations, hospital groups, and then multiple other types of organizations. For example, government organizations like the Indian Health Service. Next slide, please. All right, so this is really kind of a graphic to show you how the program operates. So over on the left, you see kind of the number one. This is the application process. So an organization applies to be a portfolio program sponsor, assuming they are approved. What happens next is they're sort of giving us information about what's happening within the organization, right? So they're already monitoring and tracking improvement work that physicians and physicians assistants are engaged in. And when they get an activity or when they come across an activity, design an activity or improvement effort, whatever word you would like to use, that then is submitted to the portfolio program, which we then vet that and pass it on to the appropriate member boards. And simultaneously, organizations that are part of the program then submit us information, some key demographic details about the physicians and PAs that are participating in those works. And we then pass that along to the certifying boards, which then award the credit either in the physician or the PA portal, again, whatever language is appropriate for the individual member board. But that's sort of the process, and it's just ongoing. Once an organization is approved as a portfolio program sponsor, they submit activities and completions that come, they come across, and the process just continues. Next slide, please, Spencer. And we really sort of want people to understand where we sit within that healthcare system. And you can see that that little certifying badge is in between the providers, because that really is where we sit. I said a moment ago, we're able to offer credit for work that is being done in practice on the ground. And that work, whatever that improvement work is, it relates to the system within which they work, including different care teams, facilities, service lines, sometimes students and credentialing, all of which then impacts, most importantly, the patient experience and the patient outcomes. We don't do that, but we offer credit for that. Next slide, please. Over the last decade, we have almost 5,000 activities that have been submitted for various different boards through the program, along with 52,000 instances of credit to almost 30,000 physicians. So that means that some people are participating more than once, which is fantastic. Throughout the COVID pandemic, we really did some critical work to help meet portfolio program sponsors where they were and help them meet their providers where they were. And we were able to create a very streamlined process for COVID work, which resulted in almost 10,000 completions for everything that was being done in that space. And we were very happy to be able to at least be a very tiny part of that. And right now we do have over 100 sponsors, as I mentioned. Next slide, please. So I wanted to be able to talk to you guys a little bit about what are people working on, what are they submitting to the portfolio program. And importantly, you can see on the left side of this slide that there are multiple clinical, and certainly this is not a finite list, but multiple clinical areas that are being addressed. These are the most common clinical areas that are being addressed. But also, very importantly, there are non-clinical things that people are working on that are also eligible for credit and being submitted through this program. For example, activities or improvements improvement works about access to care or efficiencies, documentation even, teamwork, satisfaction, etc. So the portfolio program allows people to offer credit, not just for the diabetes work that's happening, but also if we're working on professionalism. That type of quality improvement work, as long as it meets the requirements, is also eligible to be submitted through this program, which is really fantastic. Next slide, please. So the impact, what are people saying? What you see here is information that we have received from portfolio program sponsors. This is what they are telling us. This program helps me in my organization by supporting goals to increase engagement. It helps me in the credentialing office when folks are interested in being part of this organization, and I can say to them, hey, you know, we do require you to be certified by your member board, and also we support you in that process through this program called the Portfolio Program, and we'll be able to help you receive credit for towards your continuing certification. It certainly encourages multidisciplinary, cross-departmental collaboration by being a multi-specialty program. It provides these organizations access to the ABMS community, which they may not have had otherwise. And most importantly, it's cultivating relationships across portfolio program sponsors. And a great example of this is last week or the week before, one of the organizations that we work with said, hey, I'm working on this specific topic and I'm not quite sure how we should implement this or what types of interventions we should roll out. Do you have others you can point me to, Tina, that are working on this same type of thing? And Spencer also answers questions like these. And then we're able to locate organizations. Yep, we've got one over here, and connect those folks so that they can start sharing and talking about, well, what are you guys doing? And what are you guys doing? And how is that working? And what should I avoid? And that, I think, is probably the best part, the best thing that we're hearing from people with regard to the impact on organizations from this program. Next slide, please, Spencer. And then very importantly, most importantly, the impact on the diplomats and the physician assistants. Again, this is their words, not ours. So with regard to their practice, for example, the most important thing that diplomats are saying that they're getting from this program is I get to get credit for things I'm already doing. I don't have to do something extra. I'm being more efficient and I'm saving more time and my documentation is improved. With regard to my certification, I don't have to go elsewhere to find that. I actually get credit for work that I'm doing every day that I identified even in some cases, which is, again, relevant to practice, less administrative burden because we're helping them submit these activities and their completion information to the member boards who then award the credit. So it's saving them time in that regard. And most importantly, at the bottom of this slide, people have told us that their physicians are saying, wow, you know, being able to have this process in place, this program in place in our organization really is helping with mental state. It's helping reduce burnout and bringing back the joy to practice. And that is the real reason that we are here. And next slide, please, Spencer. So a couple of our portfolio program sponsors do annual reports, and they shared those things with us at the end of the year, which is really fantastic. And these are just some of the things that physicians and physicians assistants within their organizations have said that they have reported back out to us. So they're loving the portfolio program because it recognizes their improvement needs. It encourages collaboration. And then importantly, of people who have participated in activities that were made eligible for portfolio program credit, they agree that it helped them to find solutions and that they will directly be able to improve patient care because they're able to get credit for working on these different improvement efforts. And with that, I think that is my last slide for now. I am going to go ahead and pass it on to Nemours Children's Hospital, and Lloyd and Lacey, it's all you.
Thank you, Tina.
Hello. Okay. I am, thank you for inviting us to present today. I am Lloyd Work. I serve as the Associate Chief of Quality and Safety at Nemours Children's Hospital in Florida, although I'm representing Nemours Children's Health, and I'll speak a little bit more about that in a moment. And I'm joined by Lacey Sterling. Lacey is our portfolio manager, and we're going to give you a little overview of our portfolio, what we do as portfolio sponsors and why we do it. We're going to share some secret sauce. Okay, so get your recipe books out. who's involved, how we run the program. And after a dozen years of doing this, we can even comment about the secret of sustainability. I'll take the next slide. Okay, so our MOC program has been in existence at Nemours Children's Health for over a dozen years. We have about 1,100 physicians caring for patients in 96 sites in 4 states. Our children's health system is committed to all aspects of children's health, from programs in our communities, driving care upstream, to local activities, to subspecialty care and our multiple satellites in the communities that we serve. And we have 2 anchoring children's hospitals. And I'll take next slide. Okay, so we actually started back in 2010 with an American Board of Pediatrics portfolio, and this program was initially housed in our Department of Quality and Safety. If you just count ABP physicians, that's about a little over half of our faculty. 588 individual physicians had over 1,000 completions among 72 QI activities in the last dozen years. We did have that 588 does represent a little bit of an attrition. Any single physician could have engaged in 1 to 6 activities. And today, approximately 680 ABP board certified physicians are eligible. But we saw an opportunity in the last year to join the ABP MOC portfolio. This will then allow us to expand our scope to approximately 500 non-ABP board certified physicians. And it also allows us to expand to physician assistants. I'll take the next slide. So if you look at our portfolio, 57% of our physicians are ABP board certified, but you can see that we have physicians from across the various specialties, and that's why we joined the ABMS. Take the next one. So just looking at some of our activities over the last several years, we tend to average about 84 activity completions per year. And you can take the next slide. If you look at our Pareto chart, and we know we like QI work, so Pareto charts are our buds. Popular topics have spanned the steep domains: promoting safe care like medication safety and hand hygiene, effective care as in obesity management, asthma care, preventing sepsis, and a host of neonatal topics. We also have been working on equitable care in our SDOH projects. Some 80% of physicians are engaged in these, in those top 15 projects, the vital few. But as Joseph Duran reflected in the latter years of his career in writing about Pareto tables, the remaining 20% are the useful many, representing more than 50 other projects, primarily championed by their physician team leaders. And if you'll go to the next slide.
All right, thanks, Dr. Work. So as Dr. Work mentioned, I'm going to go a little bit over what we do and why we do it. We offer several ways for our physicians to gain MOC points, both parts 2 for CME for mock, as well as part 4, quality improvement or QI activities. For part 4, physicians have opportunities to participate in a number of QI projects. For example, we have several stock modules available, which physicians can find on our MOC webpage. We aim to align those QI projects with the priorities of our newest strategic plan and community health needs. We also have physician champion-led projects, the topics for which the physicians themselves get to choose and conduct to address real concerns in the clinic to improve on. One way to do this is through our Quality Champions cohort, which is a 9 to 10 month cohort of physicians, or it can be done individually or in small groups. Finally, we can also offer MOC in retrospect for physicians who have already completed a project and can then provide proof of meaningful participation, such as a poster presentation. Our portfolio program also offers individual QI consultation by Dr. Work and myself for those physicians or PAs who may like a little more guidance or orientation for their project or just want to ensure that they have all their ducks in a row. Additionally, we have began offering mock part 2 credits for a variety of our internal CME events and activities, such as our pediatric grand rounds, which happen weekly, our Hot Topics in Pediatrics conference, and our Hot Topics in Neonatology conference, among others. Next slide, Spencer. And as I briefly just touched on a moment ago, physicians must reflect meaningful participation in quality improvement efforts to be accredited these MOC points. And meaningful participation must include all of the elements above, evidence of QI training, being intellectually engaged, testing their changes, reviewing their measures over time, reflecting on that progress, balancing their measures, and then collaborating with other team members. Next slide, Spence. This is you, Dr. Work.
Oh, that's me. Okay. So I think as Lacey mentioned, how can physicians access the program? Well, we have our stock modules, and we maintain on our website a deep link for stock modules that leads them to our learning management system. From there, they self-register for they do a web-based training around the fundamentals of quality improvement. They get a overview of the stock modules, aims, measures, proposed change packages, and then they self-register for this activity, and they go forth and do. So those are our stock modules. And they include things around improving obesity management, improving the screening of adolescent depression, and other projects that have been previously vetted. We have our champion-led projects, and in order for a champion to start a project, they do an online QI interest form, they get a consultation, and then we distribute that one-pager on the right that announces the project that they can then share with their colleagues. And then we have email communication. Physicians and PAs can access us through a number of different emails. We have direct communication to our core team, and then participation in related programs. So we try to meet our physicians where they're at and give them lots of different entry points into the program.
Next slide, Spence. All right, and as Tina briefly touched on in the beginning of this webinar, how does our mock program benefit our physicians? So the program provides flexibility in that physicians can start and proceed at their own pace within their own mock cycles. Data can also be obtained internally, reducing time and research on behalf of the physician. Our data analysts from our team assist with data tasks, questions, and support. Physicians are sent timely reminders with surveys to help keep them on their timeline. And by offering mock for a growing number of programs, this also helps our physicians, again, get credit for the work they're already doing, which, as you know, reduces that burnout and creates a little more joy in the workforce. It goes without saying that our internal mock opportunities are also free of charge, which can't be said for some of the external programs and events. Mock is also linked to our physicians' performance metrics and annual bonus, so this just adds a little icing on the cake. Our team keeps the mock wheels turning because we have an array of skills and experience, and this proves helpful in the success of our program, especially under the leadership and guidance of Dr. Work. We have a number of platforms that we use to keep that conversation flowing, a virtual huddle board that we use each week as we meet to make sure that all our ducks in a row and everything is going smoothly and nothing gets lost. Next slide, Mr. Spencer. While on the subject of benefits, let's talk a little bit about benefits that are available for the organization as a whole, or for your organization potentially. With the aforementioned internal data extraction, this means that our data remains behind our firewall, which reduces unintended research or data breaches. The MOC program also calls for interdisciplinary works and cross-campus collaboration, encouraging alignment to those institutional goals and resulting in better patient care. The MOC program has the potential to produce a return on investment as well, although I understand that's a little bit of a slippery slope. We used a formula based on the University of Utah's like a model equation using a 1.2 FTE for our program, which we calculated can save approximately $218,000 per year. Finally, MOC can add to your national reputation. So an institution of doctors who are continuously learning and improving their best practices shows a commitment to quality and patient safety. Additionally, the outcomes from QI projects positively increases our level of patient care and improves processes, which does lead to better patient experiences. All of that leads upstream to Nemours' national reputation and helps us create the healthiest generation of children. Next slide, please.
Okay, so how do we run this program? We must have a staff of thousands, right? To serve, almost 100 different sites. You can go to the next slide. To serve almost 100 different sites, and but we don't. We have a coordinator, part of an analyst, and part of a director, and that's it. Okay, so you might say, well, how can you run a program with that with the scope of reaching 1,100 docs across 96 sites? Well, we do that by leveraging everybody. We leverage our QI specialists, education specialists, administrative support, and as the program has evolved, it's had a number of different benefits and have pulled along folks external to the core team. So we have our core team of just 3 folks, and it is and with its success, it's actually been embedded within our institutional strategic plan to promote clinical excellence and interprofessional education. Next slide. So how do we? So I would suggest that that MOC programs take a village. It takes involvement of leadership. It takes a lot of data, work, and we work closely with our informatics teams. We make use of Click products like ClickSense and ClickView. We have regular data extracts. We work closely with our medical staff and with individual medical and surgical departments. We work with marketing and communication, and we've built some custom applications to make our work smarter and easier to accomplish. Next slide. So here are some screenshots of, we have a QI tracker tool. When we started the program a dozen years ago, we used an Excel spreadsheet. Now we have a tool that's built to track various individuals and where they are in their projects. We keep a virtual huddle board running that we go over on a weekly basis to continually update our projects. In addition, we have Click. We make use of various Click products like this ClickSense adolescent screening dashboard. And if you click again, that's great. And then working with our marketing communications team, we've built an online presence that folks can access many of the resources that they need. They can go ahead and find stock modules. They can propose a champion-led project, all by going through our internal website. We also, so in addition to our internal website, we also have annual drives through general and directed emails. We have brochureware. We engage physicians when they're onboarded. We do our road shows. We even have a handy dandy video that you can watch if you use your smart device and point it at this QR code.
And if for any reason that doesn't work, please let me know and I'll drop the updated one in the chat. Okay, next slide, please, Spencer. So how do we plan for and implement sustainability? Next slide, please. Dr. Work, we have your initials on this one, sir.
Oh, okay. Well, I thought, okay, sure. So sustainability. So how do you sustain a program like this? You need leadership support. Part of having leadership support is that you have to report to your leadership what you're doing, and then prefer, if you can, get it on their strategic plan. If you're on their strategic plan, it generally means that you have access to some resources. Awareness of value. We try to capture, testimonials, attach some of our testimonials that we share. I appreciate the Nemours MOC program team support for me to champion a quality improvement project, and they're ensuring participants got credit with their board. Okay. We have procedures and reliable methods. So this way, by having, our systems in place, it helps, with sustainability. We've integrated Part 4 credit into other programs. So we, whether it's part of MD comp bonus compensation or as a benefit of participating in our Quality Champions program, we try to integrate our Part 4 activity in other programs. We make use of kudos and recognitions to folks in their projects, send them little, thank you notes for their activities, and they come back for more. And we try to embed our Part 2 activities in our grand rounds, our M&Ms, our mandatory training courses, our faculty development, and other educational programs. So by making the MOC program kind of ubiquitous, it is sustained. I think that's all I got.
Yeah, we have a final thank you slide, Spence.
Oh. Well, thank you.
I love that visual. I'm clapping too.
Thank you.
Thank you, Lacey, and thank you, Dr. Work. All right, well, next we're going to move on to the University of Michigan with Tasha and Ellen.
Hi, I'm Tasha Vochelli. I'm a project manager in the quality department at University of Michigan. And my partner, Ellen, is online as well, although her microphone may not be working, I don't think. Right, Ellen? But Ellen is also a program manager in the quality department, and we both we co-manage the ABMS Portfolio Program at Michigan Medicine. Next slide. So, University of Michigan Health at Michigan Medicine, we are a public university-owned integrated academic health system located in beautiful Ann Arbor, Michigan. We have about 1,000 beds on the hill, as we call it. So in our central campus, we have about 46,000 inpatient discharges and 2.4 million outpatient visits every year. We have a closed medical group, which means that all of our physicians and PAs are employed by the hospital, and there are about 3,000 of them combined. And we have a growing network of affiliates statewide. We just we have some wholly owned subsidiaries on the west side of the state and in mid-Michigan. So we definitely have a big system in the state. And our ABMS portfolio program is housed in the quality department. Next slide, Spencer. So just for background, we're well established as a portfolio program sponsor. We joined in 2011 at the pretty close to the inception of the program. And these efforts were led by Dr. Van Harrison in our institution. And he has been kind of like a leader through this until about 3 or 4 years ago when Ellen and I took over for him. So our program evolved from some projects in the ambulatory care guidelines area. And we do have a relationship with the CME office, but our program is housed in the quality department, which is pretty unique for some organizations. Initially, we did have to overcome some challenges. So one thing to know is that the perception of the value of this program varies depending on who you talk to. So in our state, all of our surgeons are participate in a quality collaborative, and their board does not require them to document expressly their programs. So if you ask a surgeon for money for a program for documenting maintenance of certification projects, they say, nah, probably not. But our initial ask was to our chief medical officer, who was at that time a surgeon, and he said no. But we kept asking around, and we finally found a home in quality. Our quality officer at that time was an internal medicine physician who saw great value in this program. And even to this day. So we definitely found that the key was managing up to find the right leadership support across such a big institution, and being persistent. Just because one person says no doesn't mean that the answer is actually no. And we initially worked with physicians who were already engaged and needed to document their activities. So we figured out, what do you need to do to earn your maintenance of certification, and how can we make it easier for you? So understanding the program's benefits and limitations was helpful. And ultimately, our leaders said, why is each physician doing loads of extra work on their own, where we could definitely support them through this, and we should be supporting them. So not having them do all of their maintenance of certification on their own. Next slide. So our current program operation, we have one FTE between Ellen and I. We each have additional responsibilities within our department, so that allows us to flex our time that we spend on maintenance of certification. So if we're really busy in something else, we can focus on that. And when maintenance of certification gets busy, we can focus on that. We do about 15 to 30 QI activities per year. And normally we have 200 to 300 diplomates earning credit for these projects. And of course, in 2020, 2021, as Tina already mentioned, with the COVID opportunities, we had over 1,000 people get credit, which was really awesome. We do source our activities from a variety of places. So we do intentionally align with our institutional priorities. So each year when the institutional priorities come out, we say, what can we help with? So last year's institutional priority, like our project of the year, was Care at Home. And Ellen and I reached out to the Care at Home team and said, how can we help so that we can incentivize this program and help get physicians who participate credit for it? Ellen and I both sit on the Quality Month Posters Committee, so we review the work that's coming into the Quality Month each year. We have regular contact with our department associate chairs for quality. So we ask them, what are you doing? Do you need MOC credit for it? How can we help? At our local department, many of our internal medicine divisions especially have these focus measures that they have to work on each year, and they love documenting the work that they're doing for their PDCA cycles, to get credit for the work that they're already doing. And that is also linked to a host of other goals and targets that they have to meet each year for their compensation and all kinds of fun things like that. We do keep tabs on our continuous improvement program. So they're the ones that are doing some feet on the ground work throughout the organization. And Ellen is actually joining the continuous improvement team. So we're going to have an even closer pulse on what kind of projects people are working on. We work with our collaborative quality initiatives. These are our CQIs that are partially funded by Blue Cross Blue Shield in Michigan. And we offer credit for the work that those organizations are doing. So Michigan Medicine is the coordinating center for most of those organizations, but they serve to collaborate with hospitals across our state. So we could be potentially giving credit to our competition out there. So we don't hold it just for ourselves. We do open it up. And of course, it's a great extra benefit that we can give to our affiliates who are our key partners in the state. And we love that ABMS always has great initiatives for us. So they have templates like a out of the box, ready to go projects for opioid use and things like that. So we love seeing what they are thinking about and working on and how we can take advantage of that. Quick little ROI, return on investment calculation, is that we estimate that this saves our physicians about $900,000 in time each year because they are employed physicians. And this is just like a rough estimate. And what happened was that in 2020, Dr. Harrison had to defend our program, and in fact, all of the programs across the organization were evaluated for their value, and he did this analysis to come up with this figure, and it actually ended up saving our program because we were initially slated to be suspended, but our leaders reevaluated and they did recognize the value, and we are still here today, so that's wonderful. Next slide. So this is just kind of like a little process map of what we do. So when someone identifies an opportunity to improve their health and healthcare, we usually meet with them to understand so that they can understand the documentation requirements. And then they go back, carry out the project, come back to us and with a report using our template, or we have a variety of other options for them. But we review it, we recommend edits, we approve it, we submit it to ABMS. We also collect attestations from the participants, which Ellen would have loved to share how that works, but it's really simple. We make a Qualtrics survey that our physicians can review the reports, they can click on the survey, answer some questions, and share their reflections on the project. And then once that's done, it goes straight to Ellen's inbox and we validate the participation. Either the project leader says, yeah, they did participate, or we have another way of validating participation depending on the project. And then we submit the participant information to the ABMS. ABMS transfers that to each participant's board, and the credit magically appears on their transcripts within 4 to 6 weeks. And it's really awesome. And the ABMS is always available to help us with questions and things like that. And we're thankful for that. So next slide. We have a lot of internal resources. So we have our website, which is pretty robust with a lot of information about the program and about quality improvement in general. So our documents that are on the website have lots of examples for how you go through a PDCA cycle. So if we have a physician who is new and they don't know they've never walked through a quality improvement process before, our materials really could walk them right through it. It's almost like a class for them. And then our seasoned project leaders who've done this a million times just go straight to the report and they fill it out. And then new in the last couple of years instead of having to fill out our templated report, we do also accept posters that have been accepted to Quality Month. So if they, as long as they meet all of our needs. So that's why Ellen and I joined the Quality Month team, so that we could review posters in real time and go back to the teams and let them know, if you make sure you have a SMART goal or all kinds of different requirements. So honestly, it says that it's internal resources, but if someone were to Google University of Michigan MOC, this website would pop up and you could take a browse through it if you'd like to. Next slide. So some of the ways that we reach out to people, we have, as I mentioned before, direct contact with our associate chairs for quality in each department and our kind of frequent flyer project leads. We often present to faculty meetings or at least send them out newsletters. So this is just an example of one of our newsletters that we sent out to internal medicine last year. We try to present to the Quality Forum, which is formerly known as our Quality Council. So that's where a lot of people who are interested in quality can reach out or come together. And then we'll also put things in our internal newsletters, like our chief of brief that our chief brief, which our chief of staff puts out, or our headlines, which is our daily kind of newspaper email that we get. And the ABMS has a great marketing toolkit on our team site that they share with us, which if we're ever kind of at a loss for what kind of wording could we use in an email to somebody, we always go there and reference that as well. So next slide. I think that's it. Yeah. So I'll turn it back to Tina.
Thank you, Tasha. That was wonderful. I learned something new each time I hear you guys share kind of how you have implemented your programs and what you've been doing. So I really appreciate that. That was wonderful. Yes, so now we do have time. We have just about 15 minutes for questions for anybody who is on the call. We'll go ahead and open it up. You can use the chat or raise your hand and we can take you off mute in order to do that. And you can pose questions to any of us who have been speaking. Certainly the presenter's more important than me, but I'm here to answer questions as well. Lloyd, did you have follow-up? You wanted to share something? Oh, okay. Well, I will go through while we're waiting for folks. I will go through and just check. There were a few things that were mentioned in the slide, in the chat, and we're talking about one of the slides that had a QR code on it that was Nemours, and Dr. Work did put that QR code in the chat. So if anybody was interested in checking that out, that is there and available. Tasha, you also mentioned your guys' website. So would you mind typing that in the chat for folks as well? And we do have one question. Great, from Tandua, Washington. Can you show the slide again with the types of projects that qualify? Was that from Michigan or Nemours, Tandua? Unless, Spencer, you know exactly which one she's talking about. University of Michigan. Oh, that's you, Tasha. Sorry. So Tasha just also provided their link, the link to their information, their website for the University of Michigan. Tandua, can you give me just a little bit more info? Okay, is this the one? Thank you, Spencer. Is this the one you were talking about? Yes. Okay, great. Happy to help. Thank you, Spencer, for figuring that out. You're most welcome. And again, what you're looking at here is a top 10 list. This is not finite. There are certainly multiple other topics that people are addressing. But when a sponsor submits an activity into our system, it allows you to select, I think, up to 5 topics that are addressed within that one QI activity. And these are the non-clinical and clinical top 10 out of all activities, those almost 5,000 that have been submitted. These are the ones that are getting addressed the most.
So, Tina, it seems to it occurs to me that a common a commonality among all these topics is that they promote the STEEP domains: safe, timely, effective, efficient,
Yes, yes.
equitable, patient-centered. So if you have a QI project that is related to one of the STEEP domains, it seems like that might be approved. Am I correct?
That's a great point. And I'm really glad you brought that up, Lloyd, because I was actually going to ask if you guys could talk a little bit about STEEP, because I was watching it go across the bottom of all of your slides. Spencer, would you mind heading to one of the Nemours slides? I think probably the second or the third one is where that started. There we go. Would you mind saying a little bit about that?
So
Lloyd?
these are the Institute of Medicine, or now the National Academies uh, of Science and Engineering and Medicine domains for quality improvement, and they include, that we're looking to have care to be safe, timely, effective, efficient, equitable, and patient-centered. And if you also refer to the IHI, you might even have a QI project related to reducing burnout in physicians. So that also indirectly promotes STEEP as well.
And thank you for mentioning that. We're actually preparing for the ABMS conference, which is coming up in September for anyone who is interested. And we are doing a session on burnout, and it will be kind of a focus, like a high level focus area on all of the different activities that have been submitted related to burnout and wellness. And that were over like 60. I was just looking at this yesterday. And really pulling out what people are, the different types of interventions that they're utilizing in these, and we'll be able to share that. So it's totally on point, and thank you for sharing that, Lloyd. We do have a couple of other questions that I should answer in the chat. So Kenneth Devane says, not directly related to the presentations, but can you describe, oh, how funny, but can you describe the upcoming September ABMS conference in Rosemont? How much will relate to the portfolio program? Will we have speakers such as today? Thank you for that question, Kenneth. The answer is yes, we will have that. Actually, a couple of different things. So the ABMS conference takes place September 19th to the 21st in Rosemont. You should all be receiving information about that. If you have not, please reach out and let us know, and we'll make sure you get on that list. The day before the portfolio program, perfect, Spencer. The day before, the portfolio program is having a half-day event, just like we have done in the past a couple of times. What you're seeing on the screen right now on this slide is actually pictures from last year's session, not a pre-conference session, but a session that we had that really led us to developing this pre-conference. So there will be a half-day beforehand on September 18th. And it will be very much like what we're doing right now. There'll be some facilitators. We'll have some leadership from the ABMS, as well as from a couple of the member boards, who will be talking about the new standards that are to be starting implementation on the 1st of January, and kind of what they are, describe them, and what that means for people in portfolio program organizations, and what it means to them. How, it's going to be like a working meeting. We'll learn about the new standards and then figure out, okay, well, what does that mean for me, and how am I going to do that? How am I going to make any changes I need to make within my program on the ground here as a sponsor? What does this mean for my providers? So that's the pre-meeting to the conference. And then also within the conference, there are sessions throughout. Within every session time slot, there is at least one that is related to improvement. Some of them are from the portfolio program or portfolio program sponsors, and others are from other people outside of our or outside of this program, rather, who are talking about improvement. So it's definitely embedded throughout the conference. And thank you so much for asking that, Kenneth. And if you have any more questions, please let me know. You can do that in the chat or raise your hand. And then Sylvia McGreal, back to the chat and comments that we have. Sylvia McGreal says, can you talk about the relationship between or among portfolio program groups? How do organizations learn from one another? Thank you for that question, Sylvia. That's a great question. Lots of different ways. One of the most important things we do is we have monthly calls. The first Thursday of every month, we have calls, and those are the opportunity for portfolio program sponsors to share or present, very much like this webinar today, with their colleagues, whether it be on an administrative topic, kind of like we're talking about today, like how do you do this, or focused topics like Tasha mentioned opioids. So we have an opioid hour call for a month, for example, and several different sponsors will then share about, okay, well, this was what the need was. This was how we implemented this. This was where we implemented it. These are the types of interventions we used. This is what we measured, and this is what's working and kind of, what's not working or how we came across a barrier or what have you. So those types of calls are really helpful and people like them a lot. We also have what I'll call a quarterly newsletter, although it's not quarterly, it's a little bit more often than quarterly newsletter that is sent out. And then again, as I mentioned earlier, there's always the opportunity for people to reach out to Spencer and myself and say, I need help on this. Can you connect me with someone? And then we find people and we help make those connections, and those connections then take off outside of us. And I actually found out recently that one group of people that I connected, 3 different organizations, carried on their conversation, and they're still meeting years later, like every other month or something. They're talking with one another. So these relationships are really being fostered, and people really like that they have the ability to bounce ideas off of someone and say, how did you do this? Did that work? It didn't. What did you do? Okay, I have that same problem. I'm going to try that. Thank you. They really, what you see on the screen is reality for this group of people, whether it's virtual or in person. So thank you for that question, Sylvia. Let's see what else we have. Tina, the matchmaker. Thanks, Lloyd. Yes. Any other? Oh, we do have. Thank you, Sylvia. Yes. Yes, you are most welcome. And Rich Waters did share within the chat information about the ABMS conference. So if you haven't received that, you're more than welcome to check that link there. Like I said, you're also more than welcome to contact myself or anybody that has been on the phone today. And we're so thankful that you guys were able to take time with us today. I don't see any other questions coming in, so we can go ahead and wrap it up. I want to thank again all of the speakers today. Thank you, Tasha. Thank you, Ellen, Lloyd, Lacey. We so appreciate everything that you guys do, and they truly have been pioneers in this space, if you will. So I feel honored to be able to have them on a call with us today. And thank you, Kenneth. Kenneth says thank you to everyone and hope to see you in September. Watch for us, Kenneth, and I hope to see you at that pre-conference meeting. We would love to have you. Thank you again for taking time with us today, everybody. And Spencer, if you wouldn't mind going to the next slide, please, just to make sure that everybody has my email address. It is there. You can also take a look. Oh, plug for the posters. Sure. A couple different types of things. People can submit posters to the ABMS conference, but also I think, Tasha, you mentioned that you have a formalized process for people to be able to submit posters to you and review them. And we recently did open this program up, not just to a QI activity itself, but if somebody has presented a poster that reflects this quality improvement work, that is also eligible, as well as we're talking now about hopefully we'll be able to integrate publications. So we're really trying to broaden this door and allow people to really submit work that is credit worthy. So we're happy to be able to work in that space with everyone. Again, my name is Tina Nelson. My email address is on the screen for you. And thank you so much for spending time with us today. And reach out if you have any questions. We'll be following up with some resources to all of you. You'll get a recording of the meeting as well as the slide deck and some other things about the program that I think you will find useful. So thank you very much, everyone, and have a wonderful rest of the day. Bye-bye.